In honor of World Diabetes Day, 4 organizations teamed up and organized 3rd Living Happily with Diabetes Conclave 2023 at the Taligaon Community Center on Tuesday. Nave Mark Foundation, in collaboration with the Indian Medical Association, Goa State Branch, Lions Club International, District 317B, and the Research Society for the Study of Diabetes in India, organized the event. The event aims to empower and educate individuals living with diabetes through group exercise, diet counseling, and stress management sessions.
Director of Health Services, today as of now we have 1,80,000 patients taking medicines free of cost from Director of Health Services every month. 1,80,000. So you can imagine, and this is taking from the government. In private there might be still double of that, who might be taking medicines from the pharmacies, but this is taking only from Director of Health Services.
Means 20 to 25% of population there.
Yes, more than 25% of the population is diabetic today.
But I feel each one should be aware that approach to diabetes has to be a holistic approach. It is not just because I pop pills, I'm going to be alright.
Yeah.
Lifestyle modification, treatment, your regular medication, regular diet, exercises, all this. So, it is a very holistic approach, because diabetes is not just about insulin, it is a multi-system disease. It is not about one organ, it is a multi-system disease. So, our approach to diabetes has to be, once you are a diabetic, you have to understand that, hello, I need to change my lifestyle. It's something which is going to go a long way.
If your daily intake of sugar is above a certain limit, obviously you're going to have problems wherein your insulin is not going to be able to handle it. I mean, the doctors are here to give you all of those facts and figures, but the fact remains that people don't understand it. And we've seen that in the last couple of years, especially during the COVID period, when we assisted the health systems of Goa in providing vaccines. At that time we were doing checking of people who came in for diabetes, for their vaccines, and doing a blood test, just a random blood test. And we realized that from the ages of 18 to 30, it was unbelievable that in Goa, we were getting nearly 35 to 40% of the people who were pre-diabetic or sometimes highly diabetic and not willing to accept it. So these are the kind of awareness programs which we've been undertaking for a while, and we look forward to making people understand that diabetes is definitely controllable, and once they know that they are diabetic, at least they can take care of themselves. As Dr. Celso said earlier, people don't want to accept the fact that they are diabetic, and that becomes a big problem. Once you know that you are diabetic, you can be in control. So when we say living happily with diabetes, we don't mean that you should be doing anything about leaving all of your drugs or anything that you're taking regularly. But at the same time, if you control it, it keeps you much healthier. So that's what we do. And we will continue to assist Navemark in conducting the Living Happily with Diabetes program all over Goa. Goa becomes a test bed for us. So once we know that it's working very well, because we are such a small state, we've got so much of ability to be able to control it. Once this becomes a kind of a success story, then we can replicate it all over the country.
Is an organization which is one of the largest organizations in the country, which has probably for the first time put out a lot of papers on various things. See, whatever research came out for diabetes initially was from the West. It was not for an Indian diaspora. Now, when Research Society started in 1972, they started seeing that drugs that people were talking about for diabetics wouldn't really apply in the same way that they would apply in the West. So specific studies were done in the Indian subcontinent to see what worked and what didn't work. And so even today, when we're talking about what Navemark is doing with its lifestyle modifications, what basically happens is, this is where today we talk of putting diabetes into remission, because you can actually get off your medications if you do a proper diabetes lifestyle modification. You can reduce your medications, you can live with it and have a better quality of life.
Sandeep Tuekar, Manish Parab and Nikhil Jalmi for GOA365.